This morning I was out about 5 after 4 watering my plants, talking to my plants. I have hundreds of them, and so I'm always constantly trying to understand what they need from me and to make sure that I give it to them and individualizing it. And it sounds so silly, but you kind of individualize how you care for your plants just like you do your patients. My name is Angela Locke. I grew up in a small town in Kansas, surrounded by a loving family. My great-great-grandfather basically emancipated himself during the Civil War. After the Civil War, he moved to Kansas, and that's how he started his family here. So my grandparents lived next door to me. My great-aunt and uncle lived on the opposite side of us. My great-great-grandparents lived up the hills, and then all sorts of folks around us. We were vegetarians, and so we lived off of my grandfather's farm. Gardening was a big deal to us. We were told that, go help grandma do this, go help grandma do that. My grandmother actually died early. She died at 51 from complications of diabetes, and so I never remember my grandmother being healthy. She was always sick. She actually spent the last 4 months of her life in a hospital, so was sort of a natural way of getting to see health care during the 1970s. I'm sure there were amazing doctors and who helped care for her, but the folks I really remembered were those nurses. And then me, this 10-year-old kid who's being dragged to the hospital, but how they kind of cared for me as well. In the long run, I was destined to be in healthcare, and it sort of found me as I was looking for what am I really going to do when I get out of high school, and ended up at St. Luke's Nursing School, and it felt really right. Nursing is interesting because it's a science, but the art of it is what I really like, and that's that human connection. It may be to pass medication administration and education. It may be just sitting at their bedside. It may be transitioning them from this life to the next. You just never know, and that's what's super exciting. And even now I'm in leadership, but there's so many opportunities with nursing. It's so flexible. You can be passionate about caring for others and get paid for it. Like, you can literally do exactly what you love to do, and you can do that through healthcare. I think it's within everyone's reach to do it. You can go to school for 2 years, you can go to school for 18 months, or a 4-year, or you can go into get your master's, and it's a 5-year, and a doctorate, which is a 6-year. So there's all sorts of opportunities to get in and to continue to progress. I love what I do, and I love now that I get to grow new nurses and grow new managers. I love that opportunity. I come from humble beginnings. I think what you put your mind to, don't let anyone tell you you can't. Don't ever feel less than, just go for it. Well, my issue is rabbits. I literally feel like Elmer Fudd